Dr. Martha Whyte, Regional Director, State Health Department. Hey, Dr. Martha, welcome back. How you doing today?
Yeah.
Um, let's start here because I saw a couple of articles last night and a couple of interviews. Is there anything to this antibody testing that I'm hearing about? In other words, can we find people who have previously had the illness and recovered? Is there anything to that? What do you think?
So we use that sort of treatment in a lot of different medical processes, like different diseases. They're looking at that in New York. It's very new, so we'll follow their lead and see how it turns out for them. But it is something that has been done for other disease processes, and it makes sense because if we have antibodies to the disease, then we can give those antibodies to someone else, just like a mama does to the baby, and help them fight that disease.
You and I have talked about this. We've talked about this, Aaron and I, too, off the air and on, come to think of it. If I just sort of took a poll among everybody in Shreveport and Bossier and said, let's see a show of hands. Who thinks they've had it and gotten better as far back as maybe January and February? You think like 1,000 people would raise their hands?
I think a lot of people may assume that they have it or wonder if they've had it. There's so many viruses out this time of year, just the common cold, the flu, just that go around every year. So it's really hard to say. I just was tested myself yesterday, and I think I just have, a bad cold. I was negative, thank goodness. But, you wonder when you start having just a fever and congestion and those things, could this be coronavirus?
Well, what's your sense of that? Do you think do you think it was to some degree maybe going around before we started to pay a whole lot of attention?
Well, we know that it's been in this country for some time, so it wouldn't be surprising that it was in this state. As small as this world is, and as much as people travel, any state with large international airports like New Orleans, a lot of international travel, it wouldn't surprise me.
We got a message on our Shreveport Security Systems message board for you. So yesterday on the national news, there were many people who began backing up and changing their opinions concerning the use of protective masks for the general public. What does Dr. Whyte think about the use of masks by the public when they are out in a store?
So they are considering whether they should make a recommendation for people to wear masks, which is something that, we've always said, I've said to y'all, don't do. Mm-hmm. The reasons for that are not good. The reasons for that is they would do that. CDC would come out and say that if there was so much disease in the community that they felt like the benefit outweighed the risk. So, we know that you're at a higher risk for touching your face, and that's why we don't normally recommend wearing a mask for the flu or any virus that comes in through your face. If we see so much disease and people not social distancing and not doing the things that they need to do, they will make the recommendation. It's just safer to wear a mask, even with that risk of putting your hands to your face. That's not a good sign.
Okay. This may hit close to home, maybe not. People that are in their homes, locked down, following the rules, maybe getting a little stir crazy, and any little headache they wake up with, or any little ache in the neck or pain in the chest, they may think they have COVID-19. What are some of the first signs you should look for? At what point do you seek medical treatment? I know we've asked you this a million times, but can you go over it again? Because more people are stressing out about it now. Sure.
So, people always think of the cough. The cough is the worst symptom, but it's not the first symptom. Most of our people are having bad headache, some low-grade fever. Doesn't have to be 102. It can be 100.4, 101. So it doesn't have to be sky high. And GI symptoms, so diarrhea, some vomiting, just stomach pain. Those are the symptoms we're seeing first. Then the cough comes, and it's usually kind of a deep, dry cough, like when you take a good deep breath, and then it progresses. really you don't have to seek help unless you are feeling short of breath, where you can't catch your breath, or you feel kind of that panic feeling because you're not getting good airflow in, almost like a panic attack. Do you know what I mean?
Yeah.
And that's
the
kind of what
headaches,
would lead you to go.
the headaches, are they for someone, and I'm gonna just be blunt. It's me I'm talking about.
What?
I never get headaches. Never. The last 2 nights I've had a pretty splitting headache. Is that something I need to worry about? I mean, I took a couple of aspirins and I'm okay. But I'm like, if I'm endangering my coworkers right now, then I need to get my behind home.
Right. Right. Well, okay, so let's talk about this. A virus usually doesn't hit you in one place. It kind of tends to hit multiple places at once. So just having a headache, I wouldn't worry too much about that. I would say stress, lack of sleep.
Yeah.
Are you eating well? Are you exercising? All the things that we're kind of overwhelmed with right now. I think a lot of us are having more headaches than we normally do.
See, I'm not
But
alone, right? I'm not alone. I'm not
no,
crazy.
You are not
Okay.
alone.
Okay.
Not alone.
But at what point during this do you tell people you need to go in and get tested if other symptoms arise?
I would say if you are feeling like you're having a severe flu, maybe not keeping enough fluids in, maybe not being able to eat or rest, coughing so much that you can't catch your breath, short of breath. The main things that we're worried about is your breathing. So if you're breathing too hard, too rapidly, can't catch your breath, those are the things where you need to go see your doc. Call first.
You gotcha. Call first. The numbers yesterday that came out at noon, encouraging at all?
Well, they're encouraging on paper, but I'll tell you I have a lot of cases sitting on my desk that aren't in that numbers yet. So we're not there yet. A lot of people have asked me, is that a good sign? Of course, when we see, it slowing down a little bit. But we need to see that every day for a few days before we can start to really be encouraged.
Dr. Martha Whyte, my personal physician and coworker now. I appreciate
your concierge physician.
I appreciate your time this morning.
Anytime.
I'm sure we will chat again soon.
Anytime.